Welcome back. In this video, we'll be getting to better know the symptoms in our behavioral group, specifically anxiety, PTSD, and addiction. We'll be looking at how to observe, assess, and manage the expectations of clients with any of these symptoms. And we're going to begin with anxiety. Anxiety is the result of the brain's response to a possible trigger, either real or perceived. That trigger produces a fight or flight reaction of the sympathetic branch of the autonomic nervous system. Anxiety can manifest itself in over 100 different ways. Some your client will be able to tell you about, but some you're going to have to observe for yourself. These can include physical effects like cold, sweaty, numb or tingling hands, shortness of breath, heart palpitations, dry mouth, or nausea, and also psychological effects like panic, fear, uneasiness, and insomnia. As we learned in Module 1, direct neurofeedback can be effective in stimulating the parasympathetic nervous system, relaxing the brain from the fight or flight reactions that accompany anxiety. To track the client's progress, we ask questions before and after each session. It is a best practice to ask clients to rate their symptoms on a scale of 1 to 10. We call this process scaling. With an established numerical baseline, it is easy to both track and illustrate progress to your clients. Good examples of scaling questions are: how anxious do you feel every day on a scale of 1 to 10? How hard is it to get out of bed in the morning on a scale of 1 to 10? And how severe is your compulsion to feed your addiction at night on a scale of 1 to 10? Scaling can help you manage a client's expectations as well. Speaking of expectations, it is important to let your clients know that they may start to see changes almost right away, usually in the first session and almost always by the third. It is best practice to identify 3 or more specific things to scale and monitor with the client that can be referred to and referenced in each session to demonstrate the increasing effect over time. Clients with PTSD may display hypervigilance and overreactions to potential threats, difficulty concentrating, and insomnia. As it does with anxiety, direct neurofeedback can help lower the sympathetic nervous response for clients with PTSD. This alleviates the client from constantly feeling as though they are in fight or flight. As with anxiety, clients should start to see changes in between 1 and 3 sessions. But being stuck in fight or flight can oftentimes lead a client to self-medicate with drugs or with alcohol. This can quickly open the door to addiction. Addiction can be marked by other signs as well, including anxiety, depression, irritability, mood swings, or emotional and mental withdrawal. Direct neurofeedback doesn't directly address addiction itself. These underlying issues that can lead a client into addiction are receptive to direct neurofeedback. In our next video, we will take a similar look at some of the cognitive symptoms that are receptive to direct neurofeedback.